So sickle cell disease is actually a disease of hemoglobin. Hemoglobin is the protein inside a red blood cell that transports oxygen from your lungs to the rest of your body. And in sickle cell disease, the hemoglobin is, the way I think of it, is broken. It's not quite right. And so instead of transporting oxygen, it might drop it off early or inappropriately, but it also causes the cell to misshapen and turn into that classic sickle shape people think about, as a result of the way it reacts with the other hemoglobin in a red blood cell. In addition, as a result of the interactions within the red blood cell, it makes the red cells stickier. So normally, red blood cells aren't sticky. They easily flow through the blood vessels like water through pipes. But in people with sickle cell disease, in the tiny, tiny pipes, they can get stuck. And that's one of the main reasons people end up having pain or organ damage associated with sickle cell disease, because then it's not getting, the hemoglobin and the oxygen isn't getting where it needs to go. Sickle cell disease is caused by a single gene mutation. And when we think about this, it can be very complicated. It seems like, well, if we know the mutation, and we have known about this mutation for many, many years, why can't we just fix it? Gene therapy is designed to overcome that mutation. And I say that instead of fix it because the current gene therapies are actually not directed at the actual mutation. Instead, gene therapy is designed to give genes or change the genes that are already in the body to make healthy hemoglobin, in addition to the sickle hemoglobin. So these gene therapies don't target the actual mutation. In fact, the current gene therapies available, all those patients and all those people will continue to make sickle hemoglobin. The goal is that they make at least enough of the healthy hemoglobin to prevent the red blood cell from sickling or from becoming sticky. So right now, we know that both exa-cel and lovo-cel really result in amazing transformative improvements for individuals living with sickle cell disease. In both cases, they give enough healthy hemoglobin to allow that red blood cell to function what we think is normally or almost normally, and to deliver oxygen as it's supposed to not break down, and to allow people to have healthy normal hemoglobin levels. They have more energy and a lot less pain, and certainly no vaso-occlusive crises or a lot less of the vaso-occlusive crises, which is when the cells all get stuck in the little bitty blood vessels. It's like an envelope to mail a letter. And what we're doing here is putting a new healthy hemoglobin gene in the envelope and mailing it into the stem cell. And it inserts itself into the genetic code. So those individuals now make hemoglobin A, that healthy adult hemoglobin. It's slightly different. It's labeled with a genetic marker so we can identify it and differentiate it from hemoglobin A, and it gives it a little more anti-sickling properties. But in this scenario, those individuals will now make hemoglobin A and hemoglobin S, very similar to people with sickle cell trait. It's really important that we think about gene therapy, for now, as a transformative therapy. It is not yet curative. And the reason I say that is that when you think about a cure for a disease, that should mean to you that you may no longer have any problems resulting from that disease. And we don't know that yet about these gene therapies. Neither exa-cel or lovo-cel have enough data to really say they're a cure. What I mean is we know they transform people's lives. They significantly, if not completely, eradicate and get rid of these horrible, painful events that take over people's lives with sickle cell. So they are truly transformative. What we don't know is what happens with organ function. Are the kidneys completely protected? Is the brain completely protected? Are individuals who are receiving this therapy no longer at risk for some of the sickle cell disease complications that can cause early mortality? And unfortunately, we don't know that yet. The FDA approval of exa-cel would be tremendous. It would tell us that there is unbelievable hope for people living with sickle cell disease. No longer is it only an allogeneic transplant that offers a transformative approach to therapy. And now it is a therapy that almost anyone will be able to get